Good afternoon, everybody. Welcome to the ETF State Update. Just a reminder that this meeting is going to be recorded, and let's just do some housekeeping. We'll get into our agenda today. This is a non-camera meeting, so you don't have to have your camera on. If you're wearing your footed pajamas to stay warm, good for you. Just a reminder to raise your virtual hand if you want to ask a question or make a comment out loud. You can also make a comment in the chat. We will read the things that are put in chat, so it's in the recording. And we'll answer the questions in chat too. And just remember, if you're not talking, please have everything on mute. A recording of this meeting and the PowerPoint will be sent to you as a PDF after the meeting. It'll probably come to you next week. So you'll have all that, and then any handouts that anybody alludes to or anything will also come in that after meeting email next week. So that gets us through housekeeping. So that takes us to a Well Wisconsin update with Molly Dunks. Molly?
Great. Thanks, Tricia. Good afternoon, everybody. So happy to be here and spend a little bit of time with you all just to provide an update on Well Wisconsin. Again, this is the Wellness and Disease Management Program that is embedded in group health insurance. So all of you who are enrolled and your employees have access to this program. It's been around for quite some time. Wanted to just share the highlight on how we ended 2024 as far as participation in the incentive program. It has remained consistent. Folks who complete 3 activities, a health assessment, a health check, and a well-being activity can earn a $150 prepaid card. And so we have it broken down by the state agencies, the universities of Wisconsin, and then all of our local employers who are in the group health insurance program. So as you can see across the last 3 years and in each of our 3 different employer categories, overall participation did drop slightly by the end of 2024 as compared to the prior years. So I'm not sure, we've been racking our brains about why we think this might be and have had a hard time coming up with answers. So if any of you have any hypotheses about that and you want to reach out and let me know, would love to hear that. But as we look forward to the year ahead, hoping to continue with overall communications and promotions and hopefully with some of the new resources and activities that are available, perhaps catch some folks who may be interested in engaging as we look forward. So 2025, the overall program does remain overall similar to what it has in the past. We did communicate during open enrollment that the deadline was going to be 1 week sooner on October 10th. So I just wanted to point this out that the deadline is going to be on October 17th. WebMD is able to accommodate that deadline while still being able to get the data over to ETF for us to get to all of you for prior to the end of year payroll processing for the taxes that are applied to any incentives earned. So wanted to just point that out as a difference compared to what we did communicate during open enrollment. I love any support from any of you as it comes to communications and promotion to employees. We have a couple of websites that are really useful, has a ton of information and communications available. We have one geared Well Wisconsin for members, a web page, and we have a lot of different communications related to those that I have here bulleted on this slide, as well as additional ones. And then I also wanted to just point out that we have overall handouts as well on a monthly basis that are available that highlight all of the different programs that the dedicated WebMD team are putting on. So next year, you'll see a variety of cooking classes available throughout the year, fitness classes, webinars, workshops, which will be more of like a series-based training opportunity to connect with folks as they focus in on accomplishing their well-being goals. And then they'll sprinkle in some on-site events as well throughout the year. So the first one is January 22nd, which will be a snowshoe event or a winter hike, depending on if we have snow or not. And that'll be at Governor Nelson. So if you can hyperlink this etf.wi.gov/well-wisconsin-events on any of your intranet pages or to help promote, and we upload new events on a monthly basis there. Also want to remind you about the employers webpage. At the end there, you see the difference of well-wisconsin-employers, where you can get support for your well-being initiatives available at your workplace. So you can request on-site biometric screening events. You can request presentations to be done either on-site, virtually, via hybrid model, different interactive well-being events, and more. Next up, I want to highlight the ETF Wellness Grant. This is something we make available to our employers in the group health insurance program to really help support you with creating a culture of well-being at your workplace. The deadline for applications for this next year is next Friday. So we've been communicating this the last couple of months via the ETF Employer News. So in case you missed it or wanting to get more information, I encourage you to go out and take a look at that. If you're looking for ideas of what to do, there is a guide on our webpage that you can review or reach out, and we're happy to provide some consultation with you all. But we like to aim for one grant per employer. So if you have a dedicated wellness champion, or you're wanting to, have an idea and you want to connect with them about that, or if you are the champion, it's always kind of interesting to get input from others as well. Oops. Thank you. All right. We do have an annual Well Wisconsin Awards ceremony, so hope you can all save the date for February 25th. It'll be at Old Brick Botanical Gardens again. This is an awesome opportunity to be able to come together as a group, connect with each other, learn what's going well at your locations, and celebrate the successes that some of our different employers or individuals are accomplishing. So there are 3 different award categories, and we are looking for nominations for these. The deadline for nominations is January 3rd. So we focus in on excellence and innovation, which is looking to employers who've gone above and beyond promoting Well Wisconsin and are really looking to create a culture of well-being, either through supportive policies, environments, or creative program ideas. We also want to highlight a leader who has driven their organization toward a supportive culture. They role model a commitment to their health and encourage employees to take care of themselves as well. And then we also want to highlight an individual, personal spotlight, someone who has personally accomplished a well-being goal for themselves. And new this year, if you attended in the past, we're really trying to bring back more time and opportunity for those who are winning an award to share more about what they went through to be able to accomplish their goals, so that others can really learn more from them about that. So we're really excited about that opportunity. And then we're adding on a networking hour too at the end for anybody who wants to hang around and really dive deeper and have some more of those one-on-one conversations. And then, as always, there's support available. There are 7 dedicated well-being program managers and coordinators with the WebMD team who can be reached at this email address that's on this slide. You can also reach out to me. I'm happy to provide assistance and support as well. And then, of course, participants who have any questions should be directed directly to WebMD customer service. Unless there are any really escalated situations, then you can always, again, turn over in my direction for that as well. So I wanted to just take a minute to also show you those 2 websites, because sometimes we don't take the time to go out here. And so I just wanted you all to see what they look like and point out a few things. All of these links either go to additional handouts or information, or else, like in this case, it goes to the WebMD portal. This new 2025 calendar is a really awesome resource that really highlights all that's going to be taking place in the next year with different types of support for participants to be able to engage in well-being activities. So it highlights the different challenges that will be available, the workshops taking place, the webinars, book clubs, on-site events, group fitness classes, cooking classes, and of course, the Well Wisconsin Radio podcast, which has been a stellar opportunity to connect with experts across the state over the last few years that people have really enjoyed listening into. So I wanted to point that out specifically. We are having a request in to update a few of these things on here. So as we're getting closer to 2025, you will see some changes. For example, we still have this year's deadline, so that'll be updated and things like that. So know that that's coming. Down here, we have additional links to the portal, the podcast. This is the whole library of all the group fitness classes that have already been done since they started doing these in August. So if you want to give them a try, the recordings are out here and available for anybody to listen in. A link to a couple of informational videos about the program. This link goes to all of the events, the future events, if you want to get registered to participate in any of those, and then any past webinar recording. And then down here at the bottom is where we have resources with handouts on these different specific program options or types, like health coaching, chronic condition management, It's Your Health Diabetes, that program that's out there, and as you can see, others. And then we have a few FAQs at the bottom. And then the Well Wisconsin for Employers webpage looks like this. If you ever miss any of the champion meetings that are hosted, you can come on out and take a look at that. This link here, the Champion Network, shows and highlights who all the players are with WebMD, with ETF, with DOA, UW, etc. So that's a nice resource to be able to look at. And then there are a variety of toolkits if you're looking to do more to support different education challenges or activities with your own employees. A bit of information about the awards that I mentioned. This links back to the member page. And then this is where you go to request any support. So this is where you go to request a biometric screening event if you want to bring the team on site or virtually for a presentation. If you're doing your own thing and you want it to be counted toward the Well Wisconsin incentive, you can submit that request here. And then for that grant application, you can see that, point that out right here for you. And then here's that guide for the grant under the resources. Soon this 2024 calendar will be updated for 2025 with that same one that I just pulled up from the other page. And then just some other promotional materials. If you have any monitors at your locations that you want to add a slide to, this will link out for that. And then there is a contest that WebMD also administers every year for champions who are really engaging in the different activities and resources available and really helping us out with supporting employee well-being. And then this link goes to that handout that was a screenshot on the PowerPoint deck. And you can see the January and the February handouts. So if you have a place or a way that you want to utilize these to help promote different resources, know that that's where you can find that. And so with that, I would be more than happy to answer any questions that you have. Otherwise, I'll turn it back to you, Tricia.
Well, I don't see any questions in chat. So and thank you, Molly. Thank you very much for that presentation.
You bet. Thank you.
I think I'll take the screen back and we'll turn it over to Tom Rasmussen about life insurance premiums and alignment. Tom?
Thank you, Tricia, and good afternoon, everybody. For those of you who do not know me, my name is Tom Rasmussen, as Tricia just said, and I am the life insurance and the dental program manager here at ETF. Wanted to talk to you a little bit this afternoon about some life insurance updates that the board has recently approved and will go into effect in the coming months. So Tricia, if you could advance the slide. So first thing is life insurance premiums, and I've already seen a mistake here in this slide. Premium increases go into effect. It should read April 1st and not July 1st here for state. I was too much IAS on my brain. So we'll get that updated before Tricia sends the slides out. But as we have done in the last several years, we're in the middle of a premium increase to get the state life insurance valuation to where it needs to for long-term stability. So what that really means is that back in 2019, the board approved a 10-year long strategy, which increases the state life insurance premiums by 5% each year. As I said, we're a little beyond that halfway mark, but not quite there. So it doesn't impact every age band due to rounding and math and actuarial math, but the updated 2164 is out on the website, and I did include a link to that on the slide deck. There is no change to premium or any rate action to the spouse independent coverage. There also was an employer news article that talked about life insurance premiums that was published and sent out back in early November. Next slide, please, Tricia. Next thing is the alignment of the coverage effective dates and premium effective dates. This is something the board approved in early October at a special board meeting. And this is primarily due to IAS configuration, but it made sense to do the things that we're going to talk about next. So next slide, please, Trish. So current policy is, I'm sure most of you know, is eligibility is for premiums is based off of the first of the month following 30 days from a date of a hire for a new employee. The first of the month following 30 days from a return of an approved leave of absence, or first of the month following 30 days from a qualifying family status change. New employee starting work for you, and I filled out my life insurance application today. I would have to wait to following 30 days, the first of the month following 30 days. So I would start paying premiums as of February 1st if I was hired today. Coverage I would have effective immediately, even though I'm not paying premiums. Should something happen on my way to work tomorrow morning and I get in a car accident and pass away as a result, the life insurance death benefit would be claimed even though there's no premium being paid. With the new policy, that's going to be changing. We're going to be aligning the eligibility, premium, and the coverage date. Next slide, please, Tricia. So what the change will be is it's going to coverage and premium will be based off of the election date. So again, using today as a date, in my example that I'll give in a couple of seconds. Coverage, though, will begin on the first of the month on or after the date an eligible employee submits an application or through an approved underwritten coverage for evidence of insurability. Coverage cannot be prior or sooner to the start date of that employee. Now, the on or after is something that's there for somebody who starts employment on the first of the month. So an employee, let me use it today as an example. If I started employment today, filled out an application, I would have coverage effective as of January 1st. So the first of the month after my selection date. Employers and employees would start being billed as January 1st as well. Now, if I started on December 1st, coverage and premium would begin on December 1st. So I wouldn't have to wait the full month. If my start date and I submit applications on the 1st of a month, coverage and premium billing will start on that for that month. So again, the change there is coverage and premiums will be aligned in terms of start date. Now, when will this policy start? It's going to start sometime in May. That date has not been established yet, and it really depends on configuration of IS and the date that has yet to be determined when Securian will send the last census file over to Benefit Focus. So when that date is known, we will certainly communicate that to everybody. So it's conceivable that sometime in May, you might have an employee start today and another employee that starts tomorrow, and they will have different effective dates and be billed for their premiums differently. So it's literally going to be an overnight proverbial switch of the switch, flip of the switch. If you want more information, I did include a link to the board memo that outlines the changes that the board approved again recently. Next slide, please, Tricia. So why now? As I mentioned earlier, a lot of this has to do with supporting IS and configuration, and just made sense to examine a lot of our policies, not just in life insurance, but overall, and make some changes with the IS implementation. So it does simplify the plan management. We have heard feedback from employers as well as employees that didn't fully understand why there were different dates for coverage date start and when they're starting to be billed. So it does simplify that. It also aligns with what the life insurance industry sees as more common practice to have those two dates align, as well as supports the similar enrollment provisions that we have with the majority of our other insurance benefits. Next slide, please, Tricia. So switching gears a little bit, also wanted to make sure that folks were aware that we're going to be having a special one-time open enrollment opportunity for life insurance that's going to coincide with the next open enrollment cycle next fall. So what this open enrollment period will allow is have employees enroll in the basic coverage or increase their current coverage by one level without any type of evidence of insurability necessary. So if they don't have insurance, if employees have waived coverage in the past for whatever reason, they could apply for the basic coverage without any EOI, or increase their current level by one without evidence of insurability. Now, the one category of people that this won't impact is if an employee already has all 5 levels of coverage, this open enrollment period will not apply to them. It's for only active employees. So retirees aren't going to be impacted. Spouse and dependent coverages won't be impacted by this open enrollment period. Again, it's only for active employees. It will coincide and occur during the open enrollment period that will occur next year for all the other benefits. And again, it's a one-time special enrollment, so it's not like this is the first of many open enrollment periods. If somebody does choose to enroll, the effective date of coverage will be January 1st of 2026. And just a little footnote there is that this is contingent on the IS system being launched in July. So if for whatever reason that's delayed, the open enrollment period will also be delayed. Not that I'm anticipating that, but I just wanted to put that footnote as a caveat. Next slide, please, Tricia. So I do see there's some questions, but before I start addressing those, my contact information, my email address is here. So if you have questions, feel free to email me, give me a call if you want to talk with me directly, and I could address some of your questions and concerns if they come up later. We will be having more communications regarding these issues in the coming months. So this won't be the last you hear from me regarding these issues. So with that, I will read the questions out loud. Christine says, thank you. This change will be easier to manage employee. Well, thank you, Christine. Yep, we certainly hope so. And that, like I said, is ultimately one of the reasons that we did ask the board to approve this change. So nice to hear that you feel that way. Andrew, for new hire, life insurance coverage effective first of the month after hire or the completion election in ESS. So the new policy will is the first of the month after they complete the paperwork. So if I start today, but don't complete my application until early January, coverage and premiums will start being billed in February with the new policy. The time allowed, they'll still have 30 days from the date of hire to fill out applications. So that's not changing. Margie, employees have 30 days to make elections. Oh, there we go. Okay. What if they start January 15th and don't make elections until Feb 2? Correct. They would not, in that scenario, they would not have coverage until March 1st. It's the first of the month following their selection date. Again, unless that occurs on the first of the month. In Margie's situation, if someone made that election on February 1st, they would have coverage on February 1st. But if they waited one additional day on February 2nd, it would be pushed out to March 1st. That does not align with how other benefits work. That is going to be harder to reconcile what they should be paying, as we will have to track down the enrollment date and review the hire or life event. Yeah, I sorry to hear that, but I don't know what to say to that other than that wasn't the intention. And again, if you folks have any questions, feel free to reach out to me directly and I will respond, or if you want to talk, give me a jingle.
Well, I don't see any other questions in chat, Tom, but thank you. Let's see here, moving on. Oh, deferred comp update with Shelly Schuler. Hi, Shelly.
Tricia, thanks so much for letting me be part of the updates today. I am going to bring just a few items of note for our state employers regarding pretty much what's new with the WDC. And first and foremost, let me say thanks for everything you're doing to help your fellow state employees save for a financially secure retirement. As a supplemental plan, we know this one is totally optional, but we know it also brings large benefits for people at their retirement. So next slide, please. So what's coming in 2025 for the WDC? So this is a pretty short list, but it's got some great stuff on it. We have a new administrative fee coming for participants. It's a flat fee. There are changes to RMDs, how they're processed, which is important for our retirees. I have the 2025 contribution limits on a slide along with the catch-up features. I wanted to talk about some new distribution options that the Deferred Compensation Board approved at their board meeting last week. And then I will just close with some reminders and the list of resources for where to find what you need to know about the WDC and who to talk to if you can't find it. So next slide, please. First and foremost, on December 5th, the Deferred Compensation Board approved a flat fee for all participants with $5,001 or more in their accounts, and it's $3.90 a month, which is a total of $48.60 a year. This is really big news that the WDC will be sharing. The WDC will be updating materials, getting word out in the next several months. But this is a nice change for people. We think it will help reduce some of the fluctuation that we have seen in the recent past with trying to true up what our fees are with what's in the board's expense for the plan. And I look forward to seeing how this goes in the future. So $3.90 per month, $48.60 a year. Pretty excited. Next slide, please. We have some changes coming to how required minimum distributions will be going out in 2025. The intent is to protect participants from the unnecessary tax penalties the IRS might impose because we're going to allow forced out distributions, which means no more missed RMDs in the penalty. So participants with a termination date on file who are RMD eligible will be issued a check in late 2025 if they have not already requested or met their annual RMD. And all RMD eligible participants will continue to receive a letter in the mail each year with the amount they are required to take and instructions on how to do that. So the slide here just gives you a timeline on when this will start into place. So next summer we'll start mailing out the letters, and this is what they do now for retirees, but they'll mail that out from the WDC saying you need to take out X amount or by the end of the year or you will face a penalty from the IRS. So then in November, December, we'll mail those out if they haven't already indicated or taken the money, and then they will get everything processed by the end of 2020, April, end of February, March, to make sure that the 2025 RMDs are out. So that's a change. It was primarily put in place to help our retirees, but just wanted to make sure that this is a change also. Next slide, please. So 2025 contribution limits. The limits have gone up for most of our what I would call categories of participants. The 2024 limit for what I would call normal participants like me is $23,000 right now. Next year it increases to $23,500. The additional contribution for age 50 and older is staying the same at $7,500. You will see that there is a yellow line in the middle here. It's called age 60-63. We're calling that super catch-up. Super catch-up is new, and it's $11,250 per year. So the limit for people ages 60 to 63 is $34,750. This is a new one that came about as the changes in the federal legislation with Secure 2.0, and the board put it in play for us starting in January of 2025, so next month. And then the nearing retirement special catch-up that we've had, that changes to be basically double the regular contribution limit, so $47,000 next year. And I just want to remind folks that you can only use one of the additional options at one time. And employees wanting to use that age 50 plus catch-up, the first one on the list, should really contact the WDC office for the form and worksheet. That one does require some calculations to check out past unused contributions. The age 60 to 63 and nearing retirement, they don't need a form because they can just look at your birthday to know what you're eligible to use. Okay, next slide, please. The plan and trust changes. So in addition to looking at fees at their board meeting last week, the Deferred Compensation Board also enacted some plan and trust changes. The first of which I want to point out are changes to the Schwab self-directed option. So you might remember we have about 25 options that the board monitors investment performance, expense ratios, et cetera, for that are kind of the standard list of investment options through the WDC. For participants who want mutual funds above and beyond those, the board in 2000 added a Schwab self-directed brokerage account window. So basically participants can enroll in Schwab and then they can invest their WDC money into the mutual fund of their choice. Sorry, a little sticky throat here. And then starting this year, starting in 2025 with the actions that the board took here this year, there will be an increase in the minimum account balance necessary. So it needs to be $3,000 before you can open Schwab, and then it's a $500 minimum transfer. And there's also will be a fee to use the Schwab option, which is $60 a year, and that is $15 per quarter. And so that is an option for people. They don't have to use Schwab. This is just one of the features we have within the investment lineup. Okay, next slide, please. I wanted to talk about some distribution options that we have that the board, they were optional, but the board chose to put them in play for our employees, and I think they're good things for us. So the first is the qualified birth or adoption distributions, or QBADs. Those were originally part of the Secure Act of 2019, but we were waiting for guidance on how people could take those distributions, and if they elected to pay back the distribution, how that would work. So the good news is that clearance came out. The guidance met the needs for the board, and the board said, yes, let's put this in. And I think it's great news for parents. So participating parents may withdraw up to $5,000 per event, and the event is either a birth of a child or the adoption of a child. So you basically self-certify the event, and if you choose to, they can pay back the $5,000 within 3 years. They don't have to, but they can. Next slide, please. The next slide talks about qualified disaster recovery distributions. So these are qualified disasters as declared by the president and indicated by FEMA. So something like what have happened in North Carolina here with the hurricanes this fall. And these provisions include expanded distribution and tax relief, so they can take out up to $22,000 of qualified disaster recovery distributions, and they can also elect to repay it if they would like to. Okay, one moment. I have to cough because I've got a sticky throat. Hold, please. Okay, sorry about that. Nobody wants to hear me cough. Okay, next slide, please. The last distribution option that they added beginning next year is withdrawals for survivors of domestic abuse. And so this allows a 1-year period to take a distribution. Applicants for this type of withdrawal can self-certify a distribution of the lesser of $10,000 or 50% of their account. So this is another piece that enables our participants and our employees to take out money when they really need for, you know, different events that normally they would have had to go through the many hoops of the hardship process. These really enable people to take those out and repay them if they want in an easy way. Okay, next slide, please. I just wanted to put a little reminder out there, like I have done the last couple times, about new employees. So if they've never worked within the state system, aren't participating in the WDC, they can just do the online form that's very straightforward. They just need the plan enrollment code, which you would be able to get out of that benefits enrolling flyer, which of course changes 3 times a year. If they have previously participated in the WDC, they really need to talk to the WDC local office, because those employees have the option of either continuing with their existing account or they can start a second account. And so They need to make that decision, and Empower does a little bit more hand-holding to make sure stuff goes right for them. So just a reminder on that, so that we get things to where people want them to be. We're really trying to make it a smooth, easy experience for them, and your help with that is greatly appreciated. Next slide, please. Just a plug for the retirement plan advisors. They're out there. They're willing to come to your office. They will come and do group meetings. They will come and do one-on-ones. Whatever you need, take advantage of them. That's the bottom line. They're here to help you get word out on how people can save for retirement with the WDC. Next slide, please. Lastly, and I think I shared this last time also, where to go for help if you need it. Emily Lockwood is our managing state director at the local WDC office, and the information is listed there. If you have payroll type questions, that would be Kathy Castle in what I would call their back office. If you were on the WDC employer webinar earlier in November, you probably heard Kathy walk through what she's able to do and how she will help with those weird one-off questions. In addition, there's the login support for the Plan Service Center. So if you have changes in staff that are doing payroll with you, everybody gets their own access, etc. And then lastly, there's my name and email and phone number at the bottom. So if you have questions, comments, suggestions, ideas, you know where to reach me on those as well. Okay, so I see there are a couple questions for me in the chat, so thank you. Lisa asked about QBADs, saying, regarding the QBADs, is it still subject to the IRS penalty if they are under age 59 and a half? So no, if you're taking out a QBAD, that means you have qualified because you've had a birth or adoption, and there isn't an IRS penalty for it. That was part of the draw of adding that in for our participants, is that they would not face the IRS penalties. And Dennis, oh, hi Dennis. I may have heard you wrong, but I want to make it clear that limits for age 50 plus or 60 to 63 will be automatic, but the special catch-up near retirement is what needs to be approved by WDC. Yes, thank you, Dennis. I probably twisted that up inadvertently. Let's see, Margaret has a question. If they take a withdrawal, are they limited to making contributions for a period of time? So under these new ones, they would not be. So because they're not considered a unforeseen hardship. And those are the only withdrawals that we had for active employees up until these came into play. So an unforeseen hardship, they are limited from making contributions for 6 months, but these new distributions for QBADs, for federal disasters and domestic abuse survivors, excuse me, are not limited then on contributions. And any other questions for me?
Yeah, there's a couple more in there up
okay.
top there. Michelle's wondering, for the WDC statements, is there a way for employees to connect their WRS balance to get a more full retirement picture?
Oh, thank you. Michelle, thank you for that question. I'm sorry I didn't roll up far enough to catch that one. So yes, employees that are active and vested will have an automatic estimate come over from ETF in the late spring. We take that out of the statement of benefits and we load it into the WDC account so they can see the WRS balance, the life only one, their WDC account, and there's also a Social Security estimate. So as an active vested employee with the WRS who has a WDC account, those three big pillars of your retirement income are all in one place to view. Unfortunately, we only have that if they're vested right now, and I don't have it for folks once you retire. So this has been around for about 3 years and it's been very helpful for people. But then the ironic thing is they retire and then they're looking for their pension estimate and it's not there automatically. Now, people can go in and add their own. You can put all sorts of things into a WDC account thanks to some of the new tools that Empower brought with one of their upgrades, but it's all entirely optional.
And then Shelley, there was one more there from Amy. Can you please repeat the catch-up option the employee needs to complete a form with WDC for?
Right. So that's what Dennis was talking about, where I completely muxed up what I was talking about in my haste to get information out. I apologize for that. So if you want to use age 50 plus catch-up, you need to contact the WDC office for the form and the worksheet. So what they will do is they'll work with you to look at your years of prior employment and what you may have been eligible to contribute but did not. So say last year you were eligible for the $23,000 and you put 3 in. You would be eligible to put $20,000 in from last year plus your catch-up. But they go through and it's a math worksheet to make sure that you're putting in the right amount, and then also that Empower knows you're doing it, because otherwise it triggers different things, like it'll stop your contributions potentially. And does that help? Hopefully. I'm going to go with hopefully yes.
Yep. And then Shelley, you have that the brochure that will go out with the after meeting email, right?
Yes. Thank you, Tricia, for reminding me. Yes, there will be it's a front back flyer that basically summarizes the distribution updates, the fee change, and the updates to distribution option all in one little flyer. We're working on getting it out on the website now also, but yes, that's coming out.
And then just a follow up to the last question, Amy, who asked the last question, said yes. So you're referring to the nearing retirement special catch-up contribution?
Yes. Well, that one's an automatic double. But really the folks that are using the age 50 plus, that needs to have the form. The ones nearing retirement and age 60 to 63, as long as your birth data is on file with them, which it is, you're fine to go without the form.
Well, Shelley, once again, thank you for talking to us and reminding me why I will always be 29 years old. So
thank you, Tricia.
There's another one. Is there a way to change the name of DHS on select division employer name to be Department of Health Services rather than Health Services Department of?
Oh, I can ask for that one. I can't promise anything, but I will certainly ask about it and see what we can do.
Dennis is wondering if
yeah, Dennis, I will have to let's take that one up offline. I don't want to hold up too much more time with the presentations today.
Thanks, Shelley. Now go get a drink of water or scream or whatever you need for your throat.
Yes, sorry about that.
Thanks for going through. No worries. Thank you for
thanks for your patience, everyone. Bye now.
Before we get to our next one, there was a question that was answered in chat. I just want to make sure we get recording that I think was based off of the life insurance discussion. The question was, will the supplemental benefits, dental, vision, accident change effective dates to align with the new way life insurance effective dates will be determined based on when EE enrolls instead of based on hire date? And Douglas answered in the chat, no, this is not changing for the supplemental benefits, which should be in alignment with health insurance regarding effective date for new hires, excluding rules around employer contributions. I believe the change for life insurance was due to a constraint specific to that benefit. So I just wanted to make sure that got in there, and Amy, you saw that got answered. So that takes us to, I just wanted to give everyone a brief update on what's going on with the group insurance board and requests for proposals that are out there. So as you know, because I spoke to you before about that, we've asked employers to please serve on our request for proposals RFP committees, and a lot of you answered that call, and we really appreciate that. So we currently have 3 RFPs that will be going before the group insurance board in January and February. So what they've had to do is they've had to schedule some special meetings, and I just want to make sure everybody was aware of that. So the group insurance board is going to have a special meeting on January 15th where they'll hear the evaluation committee's recommendation for the Medicare Advantage Medicare Plus RFP, and then on the pharmacy benefit manager RFP. And then on February 26th, which is kind of the regularly scheduled group insurance board meeting, they will, in open session, they'll talk about multiple program actuarial audits, but they also will be talking about the pre-tax RFP results, and they'll be hearing the recommendation from that evaluation committee and voting on who to go forward with. All three of those contracts for those RFPs start January 1st, 2026. So just so everyone knows that. And then there'll be a special meeting March 12th of the group insurance board where they'll talk about the final and vote on the final 2026 benefit changes and then on the 2026 open enrollment dates. So that'll be a special meeting. And then the 3 meetings there in the bottom for May, August, and November are the regularly scheduled group insurance board meetings. I'm not saying there won't be more special board meetings in 2025, but those are the 3 that are out there that should continue. All the group insurance board meetings are available virtually, so you don't have to come down to Hill Farms if you don't want. You can go to any of the agendas. You see the link here in the bottom of the page, and on the top will have the Teams information, how you can log in and listen to the board meeting and view it on Teams for that. Or if you have a hankering to come down to Hill Farms, they're always held at Hill Farms. You can come down and see the group insurance board in action and listen to everyone in ETF give different presentations on different things. So I just wanted to make sure you're all aware of that. So that brings us to kind of the open session here. Does anybody have anything that they would like to discuss with the group of many people from ETF and different employers? Also, if you have any suggestions for any future ETF update meetings, we're all for hearing about it. Or if you have any concerns or anything you want to talk about, this would be a good time to do that. So I hate awkward silence. So here's what's going to happen. We're going to send you this recording of this email, or recording of this meeting rather, and a follow-up email and everything next week. If at any time you have want to talk about anything, you have my direct email address. You can find just about everybody's direct email address. Please feel free to reach out to us and just let us know, because ETF update, we want to keep you guys involved. We want to talk about things that you want to know about. So please just let us know. As for when our next ETF update meeting is going to be, we're not sure. We kind of wait till we have enough information to talk to you about, and then we come to you. They kind of are quarterly, but sometimes they're not. So I would look for another one, probably late winter, early spring is when we'll do. And someone asked, do ETF reps ever attend facility health fairs? That is something that we are discussing. They haven't since the pandemic. And we've done those things on those vendor fairs kind of online for members, but it's something that we are reevaluating, and we'll see what happens for open enrollment in 2026, or in 2025 for 2026. If you ever want an ETF rep though to come to your facilities health fairs, let us know, because at least we can put in the request and we can see the powers that be if they would want us to come. So if you ever want us there, please let ETF know, and we'll definitely do that. So I have a comment about the Optum letters that are continuing to receive even after all claims are certified. Malia, if you want to unmute yourself and talk about that would be great.
Yeah, I just I know that I've gone through all of both mine and my husband's accounts, and everything's been certified for at least a few weeks. And even as early as Monday or Friday last week, I'm still receiving letters from Optum and emails from Optum saying that I have things that need to be certified. Actually, I'm sorry, it's Wednesday, December 4th was the last one that I received. It says it's a second reminder, and everything has been certified by this point. So I don't have any outstanding FSA reimbursements that need to be cleared, but we're still receiving these letters. I understand that it's whatever. I don't worry about it, but I know that our employees get confused by this because they're continuing to get things even though their reimbursements have been cleared. So I'm just wondering if there's anything going on. Why is Optum still continuing to send things out?
Hey Trisha, I can answer that question.
Thank God you're here, Sean.
Yeah.
Yes, go ahead.
Yeah, this is Sean, the account program manager for the FSA pre-tax programs as well too. So yeah, the last couple of weeks with the last month, usually what we have with Optum is sending out these notifications to those who have unsubstantiated claims. So if you did resolve your claims, you do not have to worry about it. It's likely a timing issue that they may have sent the additional notification prior to your after your claim has resolved. So if you have resolved that claim, you did not have to worry about it. It's probably likely a timing issue that didn't get caught on with the reporting that they send out for the members as well. So we usually have Optum send out these 4 notifications to participants who have unsubstantiated claims. And so if you did get that taken care of with any of your members, they could just disregard any additional communication that came out, and members may have received it with an addition or two related timing issue in which the notification was created after the claim has been resolved. So
I guess my biggest question / issue with this is that Optum is making things a lot harder. I don't believe that we've ever had these issues with Pass C like we're having with Optum, and we have a lot of reimbursement and approval, substantiation issues with Optum continually. And this is not a new thing this year. This is every single year. Again, there's other questions in the comments here about, or in the, chat about Optum and the way that they're doing their substantiation of claims. It is really, I've had employees as well as my husband who is like, I'm out, I'm not using an FSA anymore. And I do all of his claims for him, and he still doesn't want to deal with it anymore. It's really difficult to work with them. They're not an easy company. And that's one of the biggest issues that I'm having. And I know that our employees are having the same problem.
Yeah, thank you very much for the feedbacks on that. Particularly with claims substantiation, it's always been problematic, despite what vendors we have as well too with that. So we are still continuing to work with Optum, particularly with the claims substantiation and how we can make ease of that for members to auto substantiate with claims when they're using the payment card, or such as co-pays when you go to facilities or clinics that you pay out of pocket and so forth as well too. So definitely understanding. Those are all feedbacks that we've gotten across the state from our members as well too. And no doubt, when it comes to claim substantiation, it is pain point when they're requesting for additional documentation. So we will definitely still continue to work with Optum to leverage that and how we can continue to improve that level of claim substantiation as well.
When does this contract come up that we're able to look at other companies?
Yeah, so currently right now, I think Tricia talked about it, the PTAX RFP, we're currently in the midst of it. So I think at the February board meeting, the committee is looking to make a recommendation. But the current contract with Optum does go through the end of 2025. And as Tricia stated early, the new RFP contract will start at the beginning of 2026. So.
So just so we have it for the matter recording, Aaron from UW says, for FSA unsub claims, we at the UW are getting some of the same feedback from employees. Chris Conley wrote, Optum is now requiring documentation for $15 co-pays. Has something changed?
Yeah, the copays, usually those are auto substantiated. We usually provide those copays for them to automatically substantiate, but I can pass those feedbacks back to the account management team to see if there's any potential changes. I am not aware of any changes, particularly if the copays are fixed copays. Those should auto substantiate, but we could validate that, and I could reach out to the account management team as well to see what exactly is happening with the substantiation level compared to prior times as well.
And then Aaron wrote, is Optum refreshing their reports before they send out the mailing?
I'm assuming that's probably referring to the notifications that Optum currently working through. So how they generate the reporting for the notification, they have to generate that distribution list out a week in advance. So it's about a week behind, particularly with claim substantiation. And so they do refresh the reporting, but it's a week behind particularly. And they have to get that reporting out so that they can get those emails and along with the mailing letters out to the members timely as well too. So again, kind of talk to them about potentially timing issues where members could have resolved it, and it's a week back because they need that distribution in a week advance to get the notification out, particularly with that. But the reporting itself, it does get renewed once the claim has been resolved. That distribution list does get updated, but it particularly is about a week behind, particularly related to timing issues. So if you could resolve your claims, and then a week later get a notification because that distribution list was based on a week prior to that. So.
Thanks, Sean. And then Natalie at Department of Corrections just wants us to know that she's hearing the same thing from their employees too. They're having the same issues. So that's everything in chat. Thank you, Sean. Thank you so much for being here.
Yeah, thank you. I will reach out to the account management team just regarding the copays and to see what we find, particularly with those copays substantiation issues. So.
Thanks, Sean. So that brings us to the end of the chat, and that kind of brings us to the end of the meeting. Unless someone else has something else that they would like to discuss, I just want to make sure. Thank you for everything that you guys do, and you have a happy, safe, and fun holiday season. Hopefully, we get some snow and it stops being so cold. So, have an hour back. That's ETF's gift to you to your day. Thank you, everybody. Have a great day.